Hello and welcome to another episode of Meet the Practitioners on Health Africa, and this program is brought to you by the Association of African Universities (AAU) in collaboration with the Center for Pregnancy and Childbirth Education (CPACE). Remember that on this program we discuss issues pertaining to pregnant women, childbirth, as well as early motherhood. And on today's episode we'll be discussing premature birth. Yes, it is one of the major challenges that affect families worldwide. My name is Isabella Teta Henakwa. We'll go for a quick break, and when we come back, I'll introduce our guest to you and then start with the discussion. Please stay tuned. You're welcome back from the break, and if you just joined, this is Meet the Practitioners on Health Africa. And before the break, I mentioned that today we are discussing premature birth, and we'll be looking at some challenges faced by families in the African context. We also look at the various causes of of premature birth. We'll be debunking some misconceptions and give you the facts, as well as educate expectant mothers on the appropriate things to do to prevent premature birth. Today, I am privileged to have here with me Dr. Brenda Opon-Bewa, who is a pediatrician from Kolebu Teaching Hospital here in Accra, Ghana. Hello, Doc.
Hello.
You're welcome to Meet the Practitioners.
Thank you. Thank you for having me.
Great, and it's a pleasure to meet you.
Thank you.
So today, like I said, we are discussing premature birth, but before that, I mentioned you're a pediatrician at Kolebu Teaching Hospital, but then probably tell us a few more about yourself.
Okay, my name is Dr. Brenda Opon-Bewa. I'm currently practicing at Kolebu. I'm a pediatrician, currently at the outpatient unit. I've worked a little bit in the NICU, so I've had some exposure with preterm babies.
Okay, yeah. So you made mention preterm babies, and I'm saying premature. I know it's the same thing, right? It's the same but different words, right? So when we talk about premature birth, we all know it's when a baby is delivered before the due time. So how common is this? If you can probably give us an overview of what preterm or premature birth is. Yeah.
Okay, so prematurity is the condition of being a preterm baby. And when we say preterm, it means you were born before term. Term means 37 completed weeks of pregnancy, or what we call 9 months in lay language. So a preterm baby is a baby who was delivered before 37 completed weeks, or 9 months of pregnancy. So it's very common. It's the commonest cause of death in children under 5, very, very common. And in Ghana here, between 2003 and 2019, Prof. Ncheche did a study which showed us that the prevalence of prematurity has doubled. Actually more than doubled. It has gone from 9.3% to around 19%. So it's quite common, and it's the commonest thing that will bring an infant to the NICU. So it's very common.
Wow. Yes. You made mention NICU, if you can probably give us the full meaning.
Okay, so the NICU is the neonatal intensive care unit, where we take care of infants who are born with problems or high-risk infants that need further evaluation and care.
All right. So you are saying it is very common, and it's even doubled, more than doubled for some period of time. Now, what are the causes of this and probably the risk factors associated to premature birth?
Okay, so there are many things that will predispose a baby to being preterm. So actually, according to WHO, about 15 million births worldwide. So putting it into context, that's about 1 in every 10 babies born will be premature. And these babies are usually born to mothers who have what we call high-risk pregnancies. So any pregnancy that is high risk means that the mother has a condition that puts her at risk of having complications, and she is going to give birth to a high-risk infant. This infant, it just means that this infant is going to require special care when the infant is born, and it could be just in the first few weeks after birth, or sometimes these are infants or children who require care way into their adult life because of complications they might have. So things that might predispose a mother to high-risk pregnancy or an infant to being preterm include maternal conditions of the mother. It could be something the mother might have had before getting pregnant. So what we call chronic conditions like hypertension or diabetes or even an autoimmune disease like SLE. You are going to tell me to say the full name, but any like an autoimmune disease or any other anemia, any other conditions that will affect the mother before she delivers. And then there are also pregnancy-related complications that the mother can have, like pregnancy and hypertension. So mother was not hypertensive before, but after pregnancy, she became hypertensive, which can lead to acute complications. So maybe she's hypertensive and taking her medications and the BP is controlled, but just before she got to 37 weeks, instantly BP shot up, she got complications. She had what we call preeclampsia. Baby had to come out. Diabetes in pregnancy also is one of them. Anemia is one of them. Then there are those structural abnormalities of the where the baby is lying. So in the womb, the mouth of the womb can have problems. Normally, when mommy is getting close to the time she's supposed to deliver, normally the mouth of the womb will shorten because baby is getting ready to come out. But for some people, between 4 and 6 months, then it shortens prematurely again. And baby comes out. Mommy can also have infections, urinary tract infections, sexually transmitted infections. And whenever we have infections, there's a lot of cells or things that the body brings to fight infections. These things are good, but in the environment of the womb, once they come like that, they can stimulate the womb to start contracting. And so all of a sudden, mommy was fine. She has some small fever and then baby is coming out. There are also other risk factors like the socio-economic problems. So there are also environmental things that can affect the mother. So mothers who are from not so well-to-do families. So poverty is one of them. Low educational status is also one of them.
Really?
Yes.
Okay. Yeah, I think I can link to it.
Yes. And then which usually is linked to poor antenatal attendance.
Exactly.
So these people do not go to the clinic. If they have a problem, it will not be picked up early, and so it will not be solved. And another very important thing is age. Okay, so age less than 18 and more than 35. Less than 18 because obviously they're less than 18, they're a bit younger. And then more than 35 is because these people are getting older. They are more likely to have some of these chronic conditions I talked about. So then that will feed into them having a higher risk. And then mothers who indulge in lifestyle practices like smoking, drinking alcohol, and then taking illicit drugs can also be predisposed to having preterm babies.
So you've given quite a number of causes at the same time the risk factors, and with what you're saying, meaning these can be identified and managed even before it happens, right?
So there are some that are modifiable, which means that they can be managed prior to birth, and sometimes with very adequate management, if all goes well, preterm delivery can be avoided altogether. And then there are some that may not also be modifiable or cannot be managed because some of them, like the infections, it's not that the mother has it all along and we are managing or treating it. Some of them just happen. And actually, most of the preterm births are spontaneous. So spontaneously, mommy goes into labor and baby is coming. Then some of them too are caused by us, my colleagues in the obs and gynae departments. When they assess the situation and mommy is not doing so well, they judge and then they say, let's bring baby out to keep both baby and mother safe. So, yes.
Right. So are there stages with premature birth?
Yes. So WHO has classified prematurity, okay, depending on how many weeks of pregnancy have been completed. And then sometimes also based on the weight. So for pregnancy,
the weight of the baby?
Yes, the baby after the baby is born. So for babies that come out before 28 completed weeks, they are extreme preterms and they have the highest risk. So the risk goes down as the pregnancy advances. So somebody who is maybe getting closer to 37 weeks will less likely have a preterm delivery, but they could. So between 28 weeks and 32 weeks, we say you are very preterm. So these are important terms, even legally. These are terms we use in our notes and everything, just to classify and know which risk baby is. And then between 32 weeks and 34 weeks, we say you are late preterms. So late preterms are usually a bit more mature. For example, lung maturation, by the time you get to 32 weeks, some of the important things that have to happen with your lungs have already happened.
Yeah.
And if you're at 34 weeks, usually we're not too worried about you. And then if you're 36 weeks, then you were almost there.
Yeah.
So we will still take a look at you, but we won't be too worried. Yeah. So that's the classification.
And then what's the weight?
So for the weight, yes. So for the weight, less than 1,000 grams or 1 kilo is extreme low birth weight. Then we have between 1.1 and then 1.5. We say you have very low birth weight. Then between 1.5 and 2.5 or 2.4, we say you're low birth weight. And then anything 2.5 kilogram and above, you are normal.
All right. Now, before we go for a break, I want us to discuss the effect of preterm babies. How does it affect them at the same time, the mothers? What are some of the challenges they face in terms of health?
Okay, so I'll start with the mothers. I think I've been biased. I've been talking a lot about the babies because I'm a pediatrician. So the mothers go through immense psychological stress because imagine being pregnant. The doctor has given you your due date. You know that baby's coming on 3rd February 2025. And then you're at home in October and then you're feeling some pains. You think it's Braxton Hicks, which is like dummy contractions. And then the next 2 hours, it seems like, and then baby's here. So mothers are unprepared, families are unprepared because people do financial planning before babies have to come and all of that. So it takes a toll psychologically, that's the first one. And then sometimes financially as well, because preterm care comes with a lot of costs because they have a lot of problems, and so they require a lot of medications, procedures, investigations to make sure that they are well and alive, kept alive. And so there's a lot of financial burdens. And then sometimes, because it was the mother who was having a high risk pregnancy, all of that put together with having a preterm baby, sometimes mothers don't do well. So now I'm coming to the babies. Mothers are not doing too well. They are not able to come down to give us breast milk, for example, which is the most important feed for preterm babies. So the babies go through a lot. The effects, some are acute or like in the immediate newborn period, and they also have effects that last way into their adulthood. So initially when they come, they are warm, they cannot keep themselves warm. You have come before your time, so your things are not ready. So the things that help you to warm yourself up, they don't have that. They easily catch infections because their immunity is not there yet. And then their biggest problem is breathing because their lung is not yet matured. Later we'll talk about some of the interventions that we've been able to come up with to help these things. So they have serious breathing problems. Most of them have that, and so we usually have to support their breathing, put them on oxygen and all kinds of delivery devices so that we can keep them alive. And then they can have their blood levels are low, they can become jaundiced, they can have bleeds in their brain, they can have problems with their eyes, and then later as they grow, some of them can have damage in their ears and their eyes. So some of them can have problems with vision, hearing. Some of them can have developmental problems. So you see that the time they're supposed to walk, they are not walking, even though we give a correction for when you are preterm. So if the baby who came out term is expected to walk at 6 months, if you are not working at 6 months, there's like we allow, we give some time for them to catch up. But some of them still have neurodevelopmental problems. Some of them grow up having things like attention deficit disorder, and then some of them just, it doesn't go very well for them along the line. But it's not for everybody, because that's the myth. Some people think that it's for every child. Okay.
All right, Doc, we'll go for a quick break. When we come back, we'll continue with the discussion.
Sure.
Please stay tuned. We'll be right back.
Hello Africa is a live breakfast show that aims to give you, our viewers, an informative, entertaining, and energizing start to your day. This isn't just another news show. It takes the form of vibrant magazine packed with news reviews, lifestyle features, engaging interviews, and interactive segments that put you at the center of the action.
All you have to do is grab your coffee, get comfortable, and join us for the Hello Africa morning show.
We are here to kickstart your day with the news and stories that matter to you, alongside all the fun and inspiration we crave.
Every morning, join us for
the latest headlines in African higher education, science, and
quick and informative newspaper and online news review.
Lifestyle tips on fitness, nutrition, fashion, and beauty.
Inspiring interviews with influential figures and everyday heroes.
Performances and interactive contests, and so much more.
In Ethiopia, Salam Africa.
In North Africa, Alan Afrikia.
In Swahili, Jambo Africa.
Tune in every Monday from 8 a.m. to 10 o'clock GMT. Join us to make it a fantastic day together.
Hello Africa, your daily connection to the continent. You're welcome back from the break. This is Meet the Practitioners on Health Africa, and we've been discussing premature birth. Before the break, we talked about some of the causes and risk factors. We looked at the effect on both mothers and their preterm babies. You can follow the discussions on our social media handles at Association of African Universities on AAU and Facebook. Doc, thank you for staying with us.
Thank you.
Now, so you made mention some of the effects, and I think it also aligns with some of the myths and misconceptions we have, especially here in Africa. So, and you being in the field, I'm sure you are exposed to some of the things mothers come, they say, families come, and this is. So share with us some of these myths and probably debunk it for us.
Okay, so in our African setting, we have this peculiar challenge of problems or medical problems being attributed to spiritual causes, so to speak. So usually when things like this happen, for example, even after baby has been discharged and has been sent home, baby is very small. And so maybe some people might think that this was a spiritual problem, or they have to send their baby to see somebody or something because preterm babies do not grow well, or they don't grow to their full potential, or all of them die. Some people even think that all of them die, but that's not true. The fact of the matter is that we've gone through various reasons why a baby will be born before their time, and so it's not necessarily that. And with appropriate care, early intervention, and advanced care, baby is not likely to die, or baby has less risk of dying. Okay, so that's not true. Some people also believe that the baby is not going to be able to develop properly. Like, so this baby is never going to speak, this baby is never going to walk, this baby is forever going to have like problems. Or some people believe that all preterm babies have defects in their body, so they have maybe their heart is not going to work well, or their liver is going to be bad or something, but that's also not true. There are babies who are born at term, so 37 weeks and above, who have serious defects, and they're even worse than a preterm baby. So that is not truth. Some people also believe that, oh, once you deliver preterm, it means that mommy did something wrong. You know, that is the mother who has caused it, but that's not always true at all. Sometimes actually it is from the baby. Well, you can link it back to the mother, but sometimes baby's just not growing well. Baby has what we call growth restriction. Baby is too small. We are looking at baby and realizing that baby stays in there too long, it might not grow well. So let's bring baby out and support baby rather outside. So these are some of the few things that people believe about prematurity. And
Yeah. Also, when you were mentioning the risk factors, you made mention lack of education, and you linked it to prenatal care.
Yeah.
So I want you to discuss the role of prenatal care in terms of managing premature birth.
Okay. So prenatal care is indispensable. We can't do without prenatal care. So in Ghana, we have a program where you're expected to be at antenatal at least 8 visits. We have what we call focused antenatal care. So you might be taken care of either by a physician or a midwife. And then depending on your risk, and then you're grouped and it's determined who is going to take care of you. This is important because mothers with chronic conditions or even pregnancy-related conditions can be picked up. There are a number of lab screens that are done for every pregnant woman, including HIV, hepatitis B, syphilis, and malaria from time to time, and even checking your urine for infection, which I mentioned as one of the risk factors. And so if any of these things are there, it can be picked up during antenatal care. Also, there's a lot of education that takes place during antenatal care. Some hospitals now have pregnancy schools where they arrange sessions and do all kinds of demonstration for pregnant women. And so if you absent yourself from prenatal care, it's a non-starter. We cannot pick any problem that you might have. We will not be able to monitor the growth of the baby. And if you have any complications, it will likely not be picked up, and so it will not be managed. And so you are likely to just show up and baby is coming, or show up with an emergency and we have to deliver by cesarean emergently. And so that's how important antenatal care is in preventing prematurity.
Right. And still on the management part or segment, so you made mention there are some advancement or some interventions available. So if you can mention, so a baby is in preterm baby, what do you do to support you? Like you mentioned, they are not well developed. Some of the things they need to warm themselves are not available. So what are the interventions that hospitals have to support the baby?
Okay, so to start with, babies who are born preterm have to be sent to high level or specialized care areas like the neonatal intensive care units. In Ghana, we have different grades or levels of hospitals, and not every hospital has a NICU. And so the first thing is that I will say that as part of interventions, some hospitals are equipped with NICUs. That's a big intervention because now we have NICUs in some hospitals. So that's one good thing. So we can admit them and then give them the kind of care that they need. And then subsequently, equipment for breathing, like I talked about. So we have what we call continuous positive airway pressure devices, which helps to give them oxygen at a very high pressure to keep their lungs open, because they have a problem where they can't keep their lungs open on their own, and so they can't keep air in. And then also on that, there's a medication we call surfactant, which is what you need to keep your lungs open when you're breathing like this. So we're able to give them surfactant. It's very costly, I should say, and not many people are able to afford it. Yet still, we recommend it to every parent that comes in with a preterm baby, because some of them are able to afford it. So there's also, we have incubators, which help to keep the babies warm at the appropriate temperature for the age at which they came out. Sometimes we do plastic wraps also to help keep them warm. So if you're in a facility where you're preparing to refer the baby to a high-level center, there are also these interventions that you can do to help. We also have mechanical ventilators. Those are high-level things in the ICU which help the babies to breathe. There have been programs like Helping Babies Breathe, which has to do with resuscitation. Other countries, advanced countries, have national resuscitation program. We also have a resuscitation program. And so training health workers, including doctors, nurses, midwives, is also another great intervention which has really helped, so that babies can be resuscitated either in the delivery room or continue to be resuscitated in the NICU when they arrive.
Is it the manual or you use equipment for that?
So we use simple equipment, and then we also use our hands.
To that premature.
So I might not use my hand to let's say, perform a chest compression on the baby.
Okay.
I might have to, but when we do for babies, we don't use our hands like
Okay.
this. We use like two fingers and do it very
'cause I'm just
gently.
imagining how.
Yeah, so you don't break the ribs.
Exactly.
But we use our hands to give them oxygen through what we call ambu bags or bag mask valve. Yes, and then we have warmers, radiant warmers that we put them under just to help them keep warm. Yeah, there are quite a number of interventions. Yeah.
So looking at the effect, the mental side, the economic, you said it's very, very costly. And what can families do to support a mother and also the baby?
Okay. So if you have a friend or family member who has delivered a preterm baby, that's not the time to come and perform blame games or try to be funny. That's the time to offer the mother as much emotional support as she can get. She will need a community. She will need a community, a support system around her that will help her to get rest when she needs it, to provide financially if she's unable to, and then just to get her to be stable with as few distractions as possible, because she's going to have to take care of a baby who has come before its time. Assuming she's a new mother also, that is an added stress, because being a new mother comes with its own stress. And then now you have a preterm baby. Sometimes they have to stay in hospital for prolonged periods. Sometimes mother is discharged, has to go and come and be visiting baby. So they need a lot of support, both in hospital and then from the family. And so, and then I've talked about the financial bit as well. So if sometimes families have to rally together and then provide a means of financial support for mothers.
Okay, and also let's advise the mothers as well, especially someone who is pregnant and watching us today. Probably the person is nervous or like afraid or in fear, maybe I'm going to experience this. What would be your advice to this pregnant woman? And also mothers who have premature birth, what would be your advice to them? Just some words of encouragement.
Okay, so for the pregnant woman, don't be anxious. As part of the things, one of the risk factors I should have talked about, being underweight or overweight can lead to preterm delivery. And so what I'll say is do your part, do what you have to do. If you are not yet having a preterm baby, so make sure you're eating well. Make sure you are going for your antenatal and taking all your prenatal vitamins and medications, and just stay calm. If anything happens or if you develop any complication, it will be picked up and managed. So you have to follow your doctor's advice on whatever they say. If it should happen spontaneously as well, still keep calm and then just trust for the best, because we have care available. And then if you have had a preterm baby, all hope is not lost. We are trained and resourced to a good level to be able to support the care and give them all the care and the evaluation that they need. And then going into the future as well, if they develop any problems along the way, you can always bring them back to be reassessed. And it's important to mention that, this baby was born preterm, because it gives us a whole different perspective and on how to manage the child.
And now let's focus on the government. I know for sure there are things you need, or things even if you're not needing it, there are things you think when the government should come in to support is going to also help at least prevent premature birth. So what are these things? Let's look at the government.
Okay, government, I'm looking at you. Okay, so there are systemic problems in most institutions in the country. So we need simple resuscitation devices. We need radiant heaters. Sometimes we have these things, they are broken down. There are bureaucracies in the facilities towards getting them fixed, and sometimes it's difficult. And things like surfactants, looking at the cost, I will be very daring to say that it should be put on health insurance. Yes. But if it were, because in other places, it's there. It's one of the drugs you can just request in the system, like how we request paracetamol, and then they bring the surfactant and it's given to the baby. If the lower level facilities can also be equipped with the equipment and then the services that they need to upgrade to high level care or NICU level, so that they can also take care of some of the babies in the peripheries. Because what happens is they all get brought to the bigger facilities, or they will have to be transported to bigger facilities, and sometimes even before they arrive they don't make it. So these are some of the few things that
All right, now wrapping up, I know some hospitals or some facilities, they have opportunities, things there to support mothers as well. So being at Kolebu, maybe you can share with us some of the opportunities you provide to mothers to support them.
Okay, so we have mechanical ventilators, though they are not a lot, and so if we get one too many babies at one point in time, it will be difficult. We have CPAP machines, we have incubators, we have surfactants we don't stock, but sometimes we're able to, if the parents can afford, we're able to get it. And then we have the means, the trained personnel to be able to deliver it to the babies. So yeah, we have those.
Right. Thank you very much, Dr. Bewa, for your this has been very insightful. We've learned a lot and we know what to do to prevent us from having a preterm baby. Thank you so much. And we are hoping to meet you again on another episode. This has been Meet the Practitioners on Health Africa, and today we discussed premature birth. We looked at the causes, some risk factors. We debunked some misconceptions, and also things that mothers can do to prevent them from having a premature birth, as well as the support of the families and the government. If you just joined, you can follow the discussions on our social media handles, both Facebook and YouTube, at Association of African Universities. My name is Isabella Teta Henakwa. See you again in another episode. Bye.